Hey everyone, so your early clinical exposure exam is probably just around the corner, right? And that feeling of pressure, yeah, it's totally normal. But today, we're going to turn that pressure into a solid plan. Think of this as your high-yield strategic guide to absolutely nailing the general examination and walking into that room with some real confidence.
Look, it's 100% normal to be feeling the heat. This exam isn't just about what you know from a textbook, it's about how you pull it all together under pressure. So, what we're gonna do is build that confidence with a clear playbook, a step by step guide you can lean on from the second you walk into the room. Let's get started. Okay, so here's our game plan for today. We're going to start with how you set the stage for success, those crucial first moments. Then we'll look at the overall framework for patient management. After that, we'll do a deep dive into taking a great history and performing a systematic exam. And finally, we'll talk about how to bring it all together to form your diagnosis. It's a logical flow that's designed to mirror the real thing. All right, let's dive right in. And we're going to start where the exam really begins. And that's the moment you walk through the door. Before you've even asked a single question, believe me, the assessment is already underway. These first few seconds are your golden opportunity to establish your professionalism and really set the tone for the entire encounter. Now, don't just think of this as some boring checklist you have to tick off. This is all about building trust right from the get-go. A warm greeting and a clear introduction says, "Hey, I see you as a person." Standing on their right side, that's just standard of practice. Explaining what you're about to do and getting consent, that empowers the patient. Sanitizing your hands shows you respect their safety. Every single step sends a signal to both the patient and the examiner that you are a competent and respectful clinician. All right, now let's zoom out for a second and look at the big picture. Before we get into all the little details, you absolutely need a high-level framework for managing any patient you meet. This is your mental map, your North Star. And here it is. This is the six-step framework that should be hardwired into the back of your brain for every single patient. History, exams, investigations, treatment, and follow-up. Now, for your ECE, the spotlight is really going to be on those first three, but don't ever forget that they're part of this much larger logical process. If you can master the beginning, the rest just naturally follows. Okay, this is huge. History taking is where you really level up, where you go from being a student to being a clinical detective. It is, without a doubt, the most powerful diagnostic tool you have. Seriously, if you get this part right, you can be 80% of the way to the diagnosis before you even lay a hand on the patient. Just think about that for a second. So how do we get that full story? Well, we've got these 7 pillars to lean on. Every single one of them gives you a crucial piece of the puzzle, and together they help you build a complete picture of the person sitting right in front of you. You know, it all kicks off with one really simple but incredibly powerful question. So what brings you in today? And then comes the most important part. You stop talking and you just listen. The patient's own words, those are the keys that unlock the entire case. This is the chief complaint, and it's our launching pad for everything else. Now, a lot of the time, the patient's main complaint is going to be pain, right? And when it is, you can't just wing it. You need a system. And that system, that secret weapon, is the Socrates mnemonic. Honestly, this is an absolute must-know for your exam. So let's break this down, letter by letter. And I mean, you really need to get these questions into your muscle memory. S for sight. Can you point with just one finger to where it hurts the most? O for onset. Tell me how it started. C for character. What does the pain actually feel like? You go through each one. Radiation, associations, timing, what makes it better or worse, and finally severity. This systematic approach just makes sure you don't miss a single crucial detail. Okay, so once you've drilled down on the main complaint, you've got to pull back and do a review of systems. Why? Because the patient might not realize that their nagging cough is related to their swollen ankle, but you might. So you ask these targeted questions about other key systems to see if you can uncover any other important clues. All right, you've listened to the patient's story, now it's time to read the book. And by that, I mean the physical exam. This is where we shift from the subjective clues the patient gives us to the objective signs we can find for ourselves. This is your chance to find the hard evidence that either supports or challenges the ideas you've already started forming in your head. And this is a really, really important distinction to get right. The local exam is exactly what it sounds like. If a patient comes in with stomach pain, you examine their abdomen. That's the local exam. The general exam, though, is a full survey of everything else. It's looking for clues in their hands, their eyes, their skin, things that might seem unrelated but could be totally connected to their main problem. So what's the best way to do this without missing anything? Easy. A structured, head-to-toe approach. It's systematic, it's reliable, and it makes sure you're thorough. You start with just general observations, then you move to the hands, then the head and neck, and you just work your way down. Okay, let's get practical. Let's talk about a classic, high-yield sign you might find: clinical clubbing. This is one of those textbook physical signs where the fingertips get all rounded and bulbous. And spotting this, it can be a massive clue pointing to some serious underlying heart, lung, or even GI diseases. But here's the thing, just thinking you see clubbing isn't enough. In an exam, you have to be able to prove it. And luckily, there are 3 classic tests for that. You'll check the angle of the nail bed, you'll perform what's called the Shamroth's window test, and you'll do a fluctuation test. I really want to focus on Shamroth's sign for a second, just because it's so simple and so clever. All you do is ask the patient to press the nails of their 2 index fingers together, back to back. In a normal person, you should see a little diamond-shaped window of light between them. If that window is gone, that's a positive sign for clubbing. Simple but incredibly effective.
And that right there is a perfect example of why the hands are just a goldmine of clinical clues. Seriously, beyond just clubbing, you're looking for color changes, weird shapes, deformities, anything that looks out of place. So often, the hands can tell you a story about a patient's heart, lungs, or liver before you even take out your stethoscope.
Okay, so we've gathered all our clues from the history, we've found our evidence from the exam. Now it's time for the final and honestly the most crucial step: putting it all together and coming to a logical conclusion. This really is the moment it all comes together. Everything you've gathered, it's not just a list of random facts, it's a trail of breadcrumbs, and your job is to connect them into a story that makes sense. By the end of it all, you have to be able to confidently say, based on A, B, and C, I believe the most likely diagnosis is X. That is the core skill they're testing. You can really think of the whole process like a funnel. You start super wide with the patient's story and a big head-to-toe exam, and then you gradually narrow it all down, piece by piece, to that one final point: your provisional diagnosis. Having the confidence to state your conclusion and back it up with the evidence you found, that is exactly what your examiners want to see. So I want to leave you with this one question to think about. The very next patient you see, what's the one thing you're going to consciously focus on? Is it going to be that professional introduction, a really careful look at their hands, or maybe just nailing that critical opening question? Deliberately thinking about your process is the absolute first step to mastering it. You've got this. Good luck.